Welcome to the Science of Being Well docuseries. There is a science, an art, and an unknown factor in being well. I'm your host, Dr. Erica Goodstone, Healing Through Love mentor. Each of the speakers in this series has devoted their life to educating, training, and treating thousands of clients to create and maintain health and wellness. My goal in creating this series is to encourage and enable you to become your own health advocate. Here is a brief intro to today's amazing speaker. The president and founder of the Therapeutic Alternative in Boca Raton, Florida, Liz Olivas has used her more than 32 years of practice and background in kinesiology, anatomy, physiology, massage therapy, lymphatic drainage, ortho-bionomy, and movement-based therapy to develop her unique style of therapeutic bodywork. As a Florida licensed massage therapist, she studied with Hildegard Wittlinger of the Dr. Vader School in Austria. She continued with an advanced study at the International Lymphedema and Wound Training Institute, which integrates evidence-based research and ICG fluoroscopy of the lymphatics. Liz is also an advanced practitioner and a registered instructor of Ortho-Bionomy with the Society of Ortho-Bionomy International. Her work effectively releases tension, stress, acute and chronic pain with little or no damage to surrounding tissues. She works with many patients suffering from post-surgery issues caused by edema, scar tissue, traumas, and structural misalignment. So please give a warm virtual welcome to Liz, and I'm not sure how to pronounce your last name.
That was fine. Olivas is how I pronounce it.
Okay, I knew it wasn't quite right.
Okay.
So welcome.
Thank you.
So I'm really excited to be speaking to you because I've had a few sessions of lymph drainage, but you know, people are only skilled to a certain level and you've trained a lot in this.
Right.
So I want to hear more. But my first question is, what is the key that you believe is the key to health and healing?
Well, ultimately, what I really believe is the key to health and healing and sort of becoming well or feeling whole is really, it's a physical state, but it's also a mental, emotional state. So I believe that a lot of tension and tightness in muscles is actually muscle memory of, you know, things that have happened to us in our life. And so we hold the patterns in our body of these tensions. And so I believe that release of these tensions, along with perhaps talk therapy or something that can join with body work, is one of the keys. On the other hand, because I practice manual lymph drainage, it's very interesting that in Austria, at the Dr. Vader School in Walshy, Austria, they believe that almost all illnesses start from congestion in the tissue spaces. And they believe that congestion around the cells, when blood proteins sit around the cells, then things can't transfer in correctly. And they believe that's the source of almost all illnesses, that just this congestion then builds up in the tissue spaces. And so they really believe that manual lymph drainage, and I believe that manual lymph drainage is key to helping release all of this. And in my practice, I've incorporated orthobionomy into my lymphatic drainage practice. And so I can create openings through joints, etc., to allow fluids to travel through correctly. So fluids are huge to me, and many approaches can actually help them move through transitions, through joints especially is where they get caught up.
So I want to say the first thing you said was like music to my ears, because I'm trained for decades in somatic body psychotherapy, combining
Yep.
talk with touch,
It's
Rubenberg's
way,
energy method and
absolutely.
craniosacral and somato-emotional release. And you can reach it through gentle touch and talking, and you can also reach it through the releasing work,
Well,
whatever
and I
may
think the
cause.
marriage of them is really what we're, I think the marriage of them is a huge advantage to people to have that complementary treatment. And I don't think it's extremely available for a lot of people, but I see that as being really beneficial if it's available.
And especially during COVID-19,
Yes.
so much virtual work.
Yes.
Okay, so now some questions about your work. You graduated with a bachelor's degree in fine arts. So
Yes.
what led to your interest, study, and practice of therapeutic body work?
Well, when I went through, I studied at the School of Dance at Ohio University, and in our school, it was a very well-rounded program, and so it incorporated a lot of anatomy, physiology, kinesiology, and what is called a Laban technique, which is
I remember that.
it is a body work, if you will, technique coming out of the schools of thinking around body movement. And at the time in Germany, this was very big, all these little body movements and releases. And so I was introduced to all that. And I was introduced at that time to things like Feldenkrais and massage. And so when I graduated, I was already 30. And I knew I wasn't going to, with all my friends, to New York City to try to audition for companies because I was 30. And I was thinking, how can I make a living? And I discovered that I was really good at massage, just naturally. I was receiving massage, and so I was practicing some of the things I was receiving on other people, and they told me, oh, my back bothered me for 20 years and now it feels better. So I thought, okay, this may be a way. And I thought of it really becoming a massage therapist at that time as a license to touch. And so I came to Florida School of Massage in Gainesville, and I got my license in, I think, 1987. And for a couple years, I did mainstream massage. And and that led me down a path which introduced me to manual lymph drainage and orthobionomy. And both of those modalities, when I discovered them, I knew that was my work. It was like an instant feeling, if you will, of this was complementary. This is what I wanted to do.
It's great. It's
Yeah.
wonderful when you find the work that appeals to you.
Yeah.
That's how I felt when I saw the mind-body therapy connection.
Right.
And then you just keep on studying because there's so much to understand.
Right.
Learn.
Exactly. Right.
So tell us what lymphatic drainage is. What is it trying
lymphatic
to
drainage,
accomplish? How does it work?
yes, exactly. Well, manual lymphatic drainage is a method that is able to stimulate the functioning of the lymphatic vessel system. So the lymphatic system has many different parts. I'm only going to cover a couple of them here. But, you have the lymphatic vessels, and the lymphatic capillaries, which pick up the tissue fluids and which tissue fluids can be filled with, it can be filled with everything toxic, and it can also be filled with blood proteins, and it can be filled with, tattoo ink and coal dust, and all of this stuff lives in our tissue spaces. And so sometimes what happens is these parts get very heavy and thick in our tissues. And when you stimulate the lymphatic system, and when we work repetitively over certain areas to soften the fluids, and that then allows the lymphatic system to pick up the fluids and take the waste. So the lymphatic vessels and capillaries can pick up the waste, and the fluid then travels through lymphatic vessels to lymph nodes. Lymph nodes are what we call biological filters. In lymph nodes, things are broken down into smaller parts that are more usable by the body. So if heavy, big weighted molecules, and for example,
There's
viruses.
a sound in the background that keeps...
That's my bird.
Oh, okay. As long as
I apologize.
we know what it is.
She just started a little, yeah, I don't know why she did that. Anyway, yeah, so in lymphatic vessels, there are these things called phagocytes, and I always think of them, I describe them as little Pac-Men. what they do is they chomp up large molecules into small molecules that can then be sent off to waste. Cleansed fluid can go back through the venous system into the body. Different things happen in lymph nodes, and viruses and bacterias and mold spores, all that they're all, well, viruses and bacteria are heavy proteins, and these are things the lymphatic system can break up and, turn them useless. And then, so the lymphatic system essentially cleanses the body. It takes all the waste out of the body. It's a bypass system. It's a third circulatory system, a one-way system that just collects, cleans, and then puts it back into the system.
So what kinds of conditions can be helped with lymphatic drainage?
Well, there are quite a number of conditions. I started out, when I first became certified in manual lymph drainage, I focused almost exclusively on post-surgical lymphedema, mostly breast cancer. So I treated a lot of people with big swollen arms or chest walls or backs or whatever part of their body got congested. And so I had a lot of experience in the very early days. There were very few people at the time who did that work. And so I developed a lot of experience because we were one of the few people who did it. So that's the main purpose. That's the main use of the technique, I should say, in this country. But having said that, there are many more uses of it. And so I see a lot of post-surgical knee replacements, hip replacements, shoulder replacements. So in manual lymph drainage, as well as moving the fluid, it can refine scars. They've shown in studies that, when a scar goes through your tissue, sometimes fluids don't travel across the scar. And they've shown in studies that they can actually, with manual lymph drainage, help fluids travel back over the scar. So it helps refine scars, it helps fluid travel. I've seen all kinds of conditions. I'm working on a woman right now who had to have her whole pelvic floor reconstructed after childbirth, and
Wow.
her whole, and so the consequence of all that surgery and scar tissue was her body just started to swell. So right now I'm working on helping move all that swelling, and with Ortho-Bionomy, I'm able to release the tensions that are blocking the fluids in some places. So it's a really nice marriage, because Ortho-Bionomy is it's a very non-invasive technique. It does not increase circulation. It just creates, working with the nervous system, it just creates lengthening and straightening out of muscles. And so I don't really damage the system. After surgery, sometimes tissues can be brittle, so you don't really want to go in there and dig and do deep work. You want to figure out a way. And Ortho-Bionomy is a way for me to, release those things and help fluids travel across scars, joints, etc.
So you found a beautiful combination. But
I
first, I wanted to ask about lymphatic drainage. Like, are there some conditions that it's dangerous to work with, or that you wouldn't want to work with?
Yeah, there are some contraindications. I mean, in most cases, you don't want to work with anyone that has any kind of infection. If people come to my office with anything that looks like it might be, I will send them to the doctor. I won't treat them because of fear. If someone has especially a skin infection like a cellulitis, and you do manual lymph drainage on it, it can spread it quickly. So I'm very careful with that. Also blood clots. If someone comes with unexplained edema in their leg and pain, I send them, if they have to go to the doctor and have it checked, I won't treat them until we know that they don't have a blood clot. Those are two major contraindications. There are other contraindications.
What about if someone has cancer, if they have a diagnosis of cancer? Is it dangerous to spread the lymph?
Well, there's a lot of controversy about that. And over the years, listening to many people talk about what these possibilities are, the doctors pretty much say, if cancer's gonna move, it's gonna move. That manual lymph drainage is not going to move it more than others. But, having said that, I feel when I treat someone who isn't undergoing radiation or chemotherapy, I'm careful and I talk to them about the possibilities, and I really want someone to be under some guidance. If they're doing an alternative treatment, I want them to be under some guidance of a practitioner of some sort. And so in my practice, if someone is undergoing chemotherapy, I will treat them. And I have heard lectures on some studies that actually manual lymph drainage, when someone has chemotherapy in their body, can actually be an advantage to help move that chemo through to the areas that, so I totally treat under chemotherapy. I don't treat when someone is going through radiation until after the radiation is finished.
Yeah, thank you. That was good to clarify that.
Yeah.
Because a lot of people just think, don't touch the person when they have cancer, and that's just when they need the touch and the gentle.
Well, and the thing is it's really, you have to use precautions, and you have to, be smart enough to know when what are your limitations and when do you need guidance. And so it's really good in this kind of practice to have relationships with other types of medical people or people who know more. And, you don't want to take a risk with anyone's life, or, you don't want to be, I don't want to be involved in that.
Okay. Good. Okay. So now tell us about orthobionomy. Just really what it is, where did it develop?
I know, no one's heard of orthobionomy. Orthobionomy was developed by an English osteopath. And it's a kind of an interesting little school of thought. A number of modalities have come out of these, out of the school of thought. So back in the 60s, there was an osteopath in Oregon, actually, Dr. Lawrence Jones, and he actually discovered by accident that positional release, what's called positional release, can relax muscles. And he was working with somebody who, none of the typical osteopathic manipulations were able to correct his, what they call lesions or pain in his neck. And the man said to him, if only you could put me in a position that would relieve the pain and I could sleep for a few minutes. And so Dr. Jones just moved him around and found a very awkward position, but the man's pain was gone. And so he left him, and he left the room, and he went out and treated all his other patients, and he came back to the room, and he took the man out of the position, and the man's pain was gone. And this started a process. This started Dr. Jones thinking, like, what really happened there? And so he started doing research, and he developed a technique called positional release. And he actually wrote a paper that's a journal paper in the osteopathic journals called Spontaneous Release Through Positioning. So that's where it really all started. Now, Arthur Lincoln Pauls, who developed orthobionomy, was in osteopathic college, and he came upon this paper by Lawrence Jones, Spontaneous Release Through Positioning, and he thought, I think I can work with this. His background was in martial arts, and he was looking for a modality that he could dovetail with the principles of the martial arts. And so then he discovered that this technique, and he and another osteopath got together and they refined the positions. They refined the positions so they made them more effective, and they added compression. And when you add compression to the joint, it gives the nervous system information about what you're asking it to react to. So Dr. Jones's work was really phenomenal, but the holds are like 90 seconds. And if you can imagine holding a head or holding a limb for 90 seconds, it's quite a long time. When Arthur and Basham did this work, they were able to reduce the holds to 30 seconds, sometimes 10 seconds. So, and then orthobionomy grew out of positional release. So for example, orthobionomy now we have what we call phase 4. That's sort of our positional release, where we go through all the positions of the body. Then we have phase 5, which is following subtle movement patterns. And then we have phase 6, which is working in the aura off the body. And then we have phase 7, which is long distance healing. But having said that, we also incorporate posture and pose techniques, isometrics, isotonics, exploration of movement patterns. They're all incorporated into orthobionomy. So orthobionomy is a set of techniques that are governed by a principle and a philosophy. So orthobionomy really comes under that heading. So that we have a principle and a philosophy, and a lot of our principles have to do with, we always move away from pain. We never take the body into pain. We sort of what we call make a cave around pain. And so we shorten things. And, like if you take a muscle that's this long and it has a contraction and it goes into this long, most therapies would try to stretch it and make it longer. In orthobionomy, we actually compress it, and by compressing it, you wake up the nervous system that automatically, spontaneously releases the muscle to resting length. And so that's the way we work. We work with that, and we work with our relationships. And so when I work with people, I think of that. Well, I think we listen more, we respond. So the body gives me information. When I put my hands on someone, I feel what their body is telling me, and my treatment responds accordingly. I don't go in with a preconceived idea of what I'm going to do.
I'm just really impressed with this because I have a lot of training in, trained in Feldenkrais techniques and Alexander techniques.
Yes.
And a lot of body therapies, Traeger, Pilates.
Right.
And I see this as incorporating so much of
yes.
many of these techniques.
Yes. Yes.
Myofascial
all of those
release,
things, it's all in the same vein. Exactly.
But combining it and with the stages, it's really beautiful.
Yes.
So what kind of results have you seen with orthobionomy and with the combination?
Yeah, no, I mean, I see all kinds of people. I mean, I have a number of people that come through my practice because they have a particular problem. So they have a low back problem or a neck problem, and they get a couple of treatments, and we're able to, correct things, correct alignment. I go over gait, I go over how they stand, I go over how they walk, and it brings them back into a correct alignment. I see some people also for, I see a number of people for maintenance. So I have people that come weekly, I have people that come monthly, I have people that come every 6 weeks, and it's sort of a tune-up for them, so we can help maintain their balance. I see people that are athletes, and so they're very active, and so we maintain their bodies. And so I can do that with manual lymph drainage. And so, for example, if somebody steps wrong when they're playing tennis and they get a little swelling, I can deal with that with manual lymph drainage and orthobionomy together. So it should help their alignment and help their, fluids travel more easily. And then I use wrapping and, because I have skills in both, and I bring them together for that.
And the problem that I see is that most people don't realize that this is possible. They go, not to put down massage therapy, it's beautiful, but they go to get a massage, and the massage therapist may not be knowledgeable enough about how to really release something.
Yeah.
They feel a little relaxed, but the problem isn't solved.
But it's not specific enough. Yeah, I mean, I don't really, ever want to diss any treatment. Yeah. I mean, I think there's a place for everything, but I do think orthobionomy, is a very advanced way of working. And, before I became an orthobionomist, before I even discovered orthobionomy, I remember the days when I would be massaging someone and I would think there's got to be a way to work through the body. I just felt that. And then when I discovered orthobionomy, I realized this is the way, and this is how we do it. We use the limbs as levers. So for example, if I release a psoas muscle, I use the limb of the leg to shorten the muscle because I know where that muscle attaches. I know the insertions and the origins and insertions. And so I use the leg to push it to shorten the muscle. And so that's the way we work.
And that's another piece of this, to really know the anatomy.
Yes.
So that you know
it
where
does help.
The origins and insertions.
It really helps. Yes.
Okay. So now what I just asked you before, so hopefully you're prepared to give a little demonstration of lymphatic drainage.
I can show you a few techniques.
Yeah, a few of your techniques.
So
our audience could appreciate that.
Manual lymph drainage is a skin technique. It's a very light skin technique. And so our work is to stimulate the capillaries in the very surface of the skin. And so we don't really want to work deep. We want to work on the surface, and it's repetitive, as I said, because you have two things that you're going to do. One thing is to accelerate the contractions of the lymphatic vessels. The other thing is to soften the tissue fluid. So tissue fluid has a property, and it's called thixotropic. And that means it can thicken up like jello, or it can thin out like fluid, depending on the circumstances. And so when it's very thick, it's a little bit harder to get things moving. When it's thin, it releases particles, and then the lymphatic system can pick them up. So that's why we do repetitions. And so, for example, when we open a neck, or we call it opening a neck, we might start, and I'll use one hand to just show you. We might start at the surface of the skin, and we stretch the skin back a little bit and release it, back a little bit and release it. So, you know, we do little repetitions like that, and you can do both. Some people do, they cross and do both this way, right? And then you can get the back of your neck.
And is this something we can do ourselves?
This is something you can do yourselves, yep. And I do teach people with brushes also, and these are the brushes I use here. These are imported brushes from Germany, and this is, you can't see it in here, but this is very soft. This is first cut goat's hair. So it's very soft, so it's never going to damage the skin or break the skin in any way. And so you can use the brush also to start the lymphatic vessels into action. Okay. And so having information about the lymph nodes, where the large lymph nodes are, how to drain it toward, that's beneficial. So for example, there's something called Revere's triangle, and that's very large lymph node drainage out of the neck area. And that follows this muscle. This is called the sternocleidomastoid. It follows the clavicle, and it follows out of the neck, the upper fibrotrapezius. So it's a little triangle. So I always try when I work to people to get those large nodes active, because those large nodes then can take the fluid from the skin.
Beautiful. And can you give a sample of orthobionomy? Is it possible to show
I
that?
can, yes. So for example, I think you can see, I'm going to show you a shoulder release. So in the orthobionomy, we have 8 shoulder positions. Okay, so I'm going to show you shoulder point 1, which is right under the clavicle here. It's at the end of the clavicle by the front of the shoulder, right under the clavicle. And if you press in there, it may be tender. Mine aren't tender. This one feels a little tender. So the release is, remember what I said, that we create a cave, or we create a shortening of the muscle. So the release is putting your arm across, and then I'm going to use my other hand to compress in. So I would say for you to raise your elbow so that you're just right. And then put your hand on the top of the bone. Here, do you see my hands on the top of the elbow?
Oh, the elbow.
Yes.
Yeah.
And then you compress.
You're coming underneath.
I'm going to turn sideways so you can see the compression.
Yeah, your hand is underneath. Yeah.
See, you compress that way. Right. So that's a shoulder point 1 release. And I'm going to hold it for 10 seconds or so. Sometimes, you know, because I've been doing this a long time, I developed a sort of sensitivity that you can feel when things release. And often it releases it, what feels like a release is a little rebound. So as I'm pushing in, I'll feel the bone pushing out a little bit. And then
I would
I'll
never
come back.
think that a simple thing like that can solve a problem that's in there.
Yes, yeah, and that is one release, but like, as I said, we have 8 shoulder positions, and so there may be a number of different ways to release the shoulder. In other words, you have to use more than one. Or a neck release. So for example, okay, it's like I have a little tenderness on this side of my neck, and so the same thing, the same rule applies. I'm going to shorten it. I'm going to make a little cave. And how do I do that? I rotate my neck towards it, and I tilt my head, and I no longer feel tenderness. And I hold that for a few seconds. And then come out of it, and the tenderness is gone. There's actually a book of self-care called Ortho-Bionomy Self-Care by Luann Obermeyer, and it covers almost every joint in the body. I'm sure it covers every joint in the body in how do you treat yourself.
Wow. This is amazing what you're talking about, and people can benefit. So how can they get in touch with you? And
at the Therapeutic Alternative, they can certainly call my office. The number is 561-392-3340. But I also have a website, thetherapeuticalternative.com, and that will kind of give you and everyone background about our practice.
And you also teach about it. So
I do.
Where can people find that? And who are the people that you teach? What do they have to be credentialed? What is it?
Right. Well, I can, you know, anyone with a massage license can be my student. I teach mostly people who are orthobionomists, and I have developed a class that's my own class, and it's called Fluids, Fascia, and Lymphatics. And it's basically how to use orthobionomy to move fluid through joints. That's, you know, so yeah. And those things are all available on my website. And we also have a website called Bodywork CEUs, and it just gives a list of all the classes we teach.
Wonderful, thank you. So do you have any final message for our viewers about how they can help their own health and healing?
Yeah, I think that you have to keep searching. I think if you find you go to a practice and you're not getting what you want, you have to keep searching. I mean, sometimes it takes a while to get to the right place, and it may be orthobionomy and manual lymph drainage, or it may be deep tissue massage, or it may be chiropractic, but you have to keep searching to find the right relationship, the right kind of situation that works for your body and your soul and your spirit.
Well, it's been a delight speaking with you today. Thank you so much
Thank
for
you.
joining me. And to those of you watching, I hope you've enjoyed this interview with Liz Olivas about lymphatic drainage and orthobionomy. Please visit her speaker page for more information and leave a comment on today's post in the Science of Being Well Facebook group. Check your email to continue learning more about the science of being well.